Key principles for HTA. Use of HTA in decision making. Principle 13, HTA should be timely. When should an HTA be conducted? There is no right time to conduct an HTA. It is conducted to help inform policymakers and their needs. For hospital administrators, being able to identify when a new treatment would provide the most benefit to the patient is essential. Healthcare insurers, on the other hand, may wish to know how experimental or risky a new treatment is, in order to determine if their coverage will include it. Whilst an early HTA could quickly identify if a technology is unsafe or not fully effective, if it is conducted too early, then the full impact or benefit of a new innovative drug or healthcare service may not have been fully realized. There may in fact be a number of issues that may not have been resolved so early on in it being used. For example, the users are not yet familiar with how to use it, the setup costs have not yet normalized. Furthermore, the long-term benefits may not be captured by an early assessment, and therefore HTAs should be revised when new data is available. Principle 14, HTA findings need to be communicated appropriately to different decision makers. The many interested stakeholders and parties are all different audiences for HTA findings. Each needs to be engaged with in an effective manner, which may require different forums and explanations of the same results, to suit their level of expertise and differing priorities. Principle 15, the link between HTA findings and decision-making processes needs to be transparent and clearly defined. How the results of HTA and recommendations are implemented will be highly dependent on the surrounding policy and decision-making context. Different stakeholders will respond and react to the findings differently. Consequently, it is important that there is a clear distinction between what are the results of the HTA and any subsequent decision-making. The latter is more subjective and context-specific, whilst the findings themselves remain unchanged. These 15 principles were developed as generic considerations that should be acknowledged, whatever the specific HTA question and topic in hand. They provide a good introduction to how HTA should be approached, and some simple recommendations to how HTA should be conducted, to help shape the most robust assessment possible.